There are very few things that are more confusing, polarizing, revolutionary, and not quite fully understood than artificial intelligence. Will it save the world, end it, or none of the above? Dr. Sristi Sharma joins us now from UCSF Medicine. That's a lot to put on your plate with that lead in there. So how is AI being used successfully in medicine right now? You feel more of an advocate than a pessimist about it.
I do. AI in medicine is revolutionizing medicine as we know it, Walt. AI is used for being used for administrative tasks, it's being used to provide care to patients. It is essentially making patient outcomes better, but with the caveat that it is being used or has to be used safely.
Okay. Patients have a lot of concerns about this. What are some of the concerns that you're hearing from them?
Yeah, I think generally people are worried about privacy, which is, of course, a valid concern. People, are uploading the information. In fact, there's a study that says that 1/3 of patients, 1 in every 3 patients last year in the United States used AI to ask questions about the healthcare. And of them, up to 50%, that's over half of them, uploaded their medical information into AI. That's a big number, Walt. And I think, privacy is an issue, obviously. Okay. And the other one is, AI can sound incredibly confident even when it's giving wrong answers. So those are two valid concerns that people are bringing up.
I've talked to other physicians, too, and they would be pessimistic about people going to WebMD when they have something wrong with them on the internet. Now, this is something that takes it to another level. Should people trust what an AI chatbot is telling them?
Again, it depends. Now, if an AI chatbot is being used from within a hospital system, now remember, these are regulated AI chatbots. There are physicians called clinical informaticists who are actually making sure the implementation of that kind of AI is being done in a safe manner. Having said that, if people are using AI, and that is what is happening likely out there, which is people are using their own personal versions of AI, at that point, I would be a little cautious because, again, like I said, AI can talk about something very confidently, and there's no way to validate that information. So you always need to check in with your physician before you trust the AI.
How is AI already helping people in medicine? I think when I first heard about it being integrated with medicine, I'm like, AI will quickly help find cures for cancer and other various severe illnesses.
We're getting there, but we are not there yet, Walt. How are people actually using AI? They are using AI to understand their symptoms, Walt. And I think that that education factor is very important. People are putting in their symptoms in there. They're trying to find out what diseases they could have. Again, with a caveat, AI could respond, could give you a right diagnosis, but you always need to check in with your clinician about whether that's correct. People are also using AI to guide the conversations with the clinicians, and that's the best way to actually use AI. Understand your symptoms and ask about what you could actually talk to your clinician about it.
I do a little homework before I get to you.
Absolutely,
Okay,
yes.
like that. Dr. Sristi Sharma, thank you as always.